What is regenerative medicine? Regenerative medicine is utilizing the body's ability to heal, regenerate, and repair itself without the use of drugs or surgery. In our office, we utilize 3 highly researched and successful regenerative treatments: PRP, Wharton's jelly stem cells, and stem cell exosomes. Think of these as vehicles which can take you on an anti-aging journey from damaged tissue back to repair and restoration of health. Why do millions of people use regenerative medicine? Because as we age, our stem cells rapidly decline. This means it takes longer to repair and recover, making us more prone to aging and disease. The amount of stem cells you have determines how fast you can heal and grow new tissue. The amount of stem cells you have when you're newborn is 1 in 10,000. A teenager has 1 in 100,000. At age 30, you have 1 in 250,000. At age 50, you have 1 in 400,000. And at age 80, you have 1 in 2 million. Regenerative medicine uses an assortment of health factors, including stem cells, that provides cushioning and support for a targeted area. Regenerative medicine will also seek out inflammation and degeneration to allow for repairing damaged or injured cells. Regenerative medicine is utilizing the body's natural ability to heal without the risky side effects of traditional drugs and surgery. What is PRP? PRP is platelet-rich plasma therapy. Although an emerging technology and technique in medicine, it has been used since the mid-1990s in dental and oral surgery and to aid in soft tissue recovery following plastic surgery. How is PRP administered? PRP therapy begins with a collection of 30 milliliters of the patient's blood, which is then placed in a centrifuge to separate the platelet-rich plasma from the other components of whole blood. The concentrated platelets, which are referred to as liquid gold, are injected into the site of injury. PRP activates a healing response to repair injured tissues, ligaments, cartilage, and muscles. It acts like a bridge between damaged tissue and tissue regeneration. PRP has gained most of its recognition from its use in sports injuries. In 2008, Pittsburgh Steelers receiver Hines Ward sprained his medial collateral ligament of his right knee during the AFC Championship game. Medical professionals on the Steelers training staff thought that Ward would be out for 4 to 6 weeks. This time frame was unacceptable as Super Bowl 43 was taking place within that period. With Ward's blessing, the medical staff opted to try what was, at the time, alternative treatment. The rest is history, as they say. A short time later, Ward went on to help the Steelers win the Super Bowl. The pro athlete accredits PRP to being largely the reason that he was able to play. Ward's story gained national attention, and PRP therapy started to be taken much more seriously as the use of PRP increased in orthopedic, surgery, and sports medicine. This led to the publication of many controlled studies in mainstream orthopedic journals. At this time, there are over 12,000 articles published in PubMed. Is PRP the best regenerative medicine? Although PRP can be highly effective regenerative medicine, as we age, our body does not contain as many stem cells, growth factors, or cytokines. When age is a concern, there are 2 other regenerative therapies that can be much more effective than PRP: Wharton's jelly and exosomes. Wharton's jelly is known to have 4 to 10 times the regenerative capability of PRP, and exosomes are 2 to 3 times more powerful and regenerative than Wharton's jelly. At our office, we utilize the best and most regulated Wharton's jelly and exosomes available. What are Wharton's jelly stem cells? Wharton's jelly stem cells are a gelatinous tissue-rich substance that has the same exact makeup as collagen in your body. Wharton's jelly is highly regenerative because it's derived from umbilical cord tissue that's been donated from a healthy mother of a C-section birth. Wharton's jelly creates an anti-inflammatory response. However, unlike cortisone, which is temporary pain relief, Wharton's jelly stem cells are a permanent, natural, and very effective way to repair damaged cartilage, meniscus, tendons, and ligaments. This results in long-term pain relief and function. How do Wharton's jelly stem cells work? They work in a number of ways. First, by filling in the gaps or missing tissue, the Wharton's jelly works like scaffolding under the bridge. It also contains the highest levels of stem cells and growth factors in human anatomy tissue. Stem cells from Wharton's jelly will transform into virtually any other kind of cell in your body to regenerate damaged and injured tissue. Therefore, it acts as both the scaffolding and the bridge to regeneration. Once injected, Wharton's jelly works to regenerate damaged or injured tissue, which in turn relieves pain and restores function. Millions of people have utilized Wharton's jelly because it's highly effective and has no side effects. Tony Robbins, famous for his motivational speaking, wrote a book called Life Force about the benefits of Wharton's jelly. In fact, he says, "Stem cells saved my shoulder after struggling with excruciating pain." What are stem cell exosomes? Stem cell exosomes are also a state-of-the-art treatment used for rejuvenating and repairing the body. Exosomes are 2 to 3 times as powerful as Wharton's jelly stem cells. Exosomes are how cells talk to each other. Put more simply, exosomes are how cells communicate what is needed for repair. For example, we can communicate by writing small notes to each other electronically, otherwise known as email. Exosomes are a way for one cell to email another cell that is either close or distant. And just as important, exosomes have been shown to be the source of healing information and chemicals. Exosomes are derived from Wharton's jelly. Wharton's jelly stem cells produce exosomes. So manufacturers have figured out how to derive exosomes so that they can be utilized directly for healing and regenerating damaged tissue. Used topically here on a third-degree burn victim, you can visibly see the healing effects of exosomes in 7 days and then 60 days. They are utilized widely to help NFL players regain their cognitive ability after dealing with post-concussive syndrome for years. Another use that's been very successful is the treatment of long-term COVID symptoms of the brain and lungs. Why are stem cell exosomes so effective? Stem cell exosomes are injected into the area in need of treatment, like the knee, or given by a nebulizer or IV for anti-aging. The exosomes then communicate and promote tissue repair and regeneration wherever it is needed most. They've been shown to be so effective that patients sometimes notice anti-aging benefits throughout all parts of the body. We commonly use 40 to 180 billion exosomes in one treatment. What conditions are stem cell exosomes, Wharton's jelly, and PRP used for? Regenerative medicine is used most often for cartilage regeneration, treatment for injured ligaments, tendons, or meniscus, osteoarthritis, tissue repair, bone regeneration, traumatic brain injury, long-term COVID symptoms, accelerated wound healing, hair loss, and skin regeneration. So what's next? If you have chronic pain, an injury that just isn't going away, or long-term COVID symptoms, then you're in the right place. Awesomeness happens here. We help patients just like you get back to enjoying their activities of life. All 3 regenerative therapies, stem cell exosomes, Wharton's jelly stem cells, and PRP, are highly effective, safe, and clinically researched options to help you regenerate tissue and regain your vitality. Depending on your individual situation, we will make the recommendations that are best for you. So sit back, relax, and we will be in shortly.